Hello Health on LAE is presented by the Ochsner Health System, a nonprofit academic multi-specialty healthcare delivery system dedicated to patient care, research, and education. The Ochsner Health System includes 8 hospitals and 38 health centers located throughout southeast Louisiana. Ochsner, healthcare with peace of mind.
When Rose first started with us, she was just coming out of the hospital.
It's been a better situation. I can always depend upon her to help me. I'm home, and that makes me happy.
We're here to get her back into her routine and be able to live the life she wants to live. It's an honor to be trusted with that responsibility.
Good evening, I'm Tom Bagwell, and welcome to Hello Health, a partnership with WLAE, the Ochsner Health System, and Humana to bring Ochsner's Hello Health weekly education and information series to television. Tonight we're going to be talking about hepatitis C, screening methods for it, evaluation, and treating the disease with gastroenterologist and hepatologist George Therapondos. In the second half hour of our program, we'll be taking your questions live by phone at 504-866-3200. That's 866-3200. And by email. You can email your questions to us at hhquestions@wlae.com, and you can do that right now, or you can wait for the phone calls, and that's about half an hour from now. Well, hepatologist George Therapondos received his medical training in the United Kingdom at the University of Edinburgh and the Scottish Liver Transplant Unit. He spent time in Canada, too, serving as an assistant professor and staff hepatologist at the multi-organ transplant program of the University Health Network in Toronto. He also served as director of clinical trials there, and in 2011 he was elected as a fellow of the Royal College of Physicians of Edinburgh, and he completed a master's in public health at Johns Hopkins University. He joined the Ochsner team in 2011, and it is our pleasure to welcome back to the program Dr. George Therapondos to Hello Health. Good to have you with us, Doctor.
Thank you very much, Tom.
Yeah, there's been some news since you were with us in 2011, and there's been some news since we sat down here tonight, right? You were saying the CDC has issued some new information that one of your colleagues has shared with you. So let's get right to that and some breaking news in the area of hepatitis C.
That's right, some breaking news. Please allow me to read the extract from this news alert from the CDC. It's a short one. The CDC reported that more people than ever died from hepatitis C virus infection in 2014, and that cases of acute hepatitis C doubled between 2011 and 2014. The death toll from hepatitis C reached almost 12,000 people, and despite the availability of screening and very successful treating medications, this is still happening in the U.S. today.
Well, certainly this puts tonight's program in perspective if you know someone with hepatitis C or have it yourself. So thank you for sharing that, Doctor, and to your colleague for getting you that news here tonight. So hepatitis is a disease of the liver, so it probably makes sense to start there. Remind us where the liver is in the body and the important role it plays in various body functions, because it really is an organ that impacts the entire body.
Absolutely. The liver is a vital organ. It's a very large organ that is situated in the right upper quadrant, we call it, of the abdomen. It cleans the blood, it regulates hormones, it helps with the clotting of blood, produces bile and aids digestion, and it produces a number of important constituents of blood such as proteins, and it maintains blood sugar levels too.
Okay, largest internal organ.
That's right.
For the body, right. What does hepatitis actually mean?
Hepatitis literally means inflammation of the liver. which essentially means that the liver cells are damaged by some usually external component. It may be a virus, it may be a bacteria, it may be an infection, or it may be a toxin.
Okay. Now tonight we're focusing on hepatitis C, but that's not the only hepatitis that's out there. Tell us very, very briefly about the other ones.
I suspect you're referring to the different types of viral hepatitis. Viral hepatitis means that you acquire an external virus, and there is hepatitis A, B, C, D, and E. The important ones in terms of chronic liver disease, long-standing liver disease that causes cirrhosis and end-stage liver disease and liver cancer are the hepatitis B and the hepatitis C infections.
Okay. What are some of the major causes of liver damage or hepatitis?
Liver damage in most people probably occurs because they're overweight or obese, and being overweight or obese causes similar damage to liver to the damage caused by alcohol excess. Common causes, as you can see on your screen, are drinking too much, being overweight or obese, the viral hepatitis, the hepatitis B and C, some medications, and some genetic and autoimmune diseases, although the genetic and autoimmune diseases are much less common than the infections and the toxins we ingest.
And hepatitis C more common in men than women, and not really drastically, right about 60-40?
Yes, hepatitis C is thought to be a little bit more common in men than women.
And do we know why? Do we drink more?
I don't think it's really well documented what the reason behind that is. Perhaps, I'm talking about hepatitis C. I think men probably do engage in more high-risk activities than women in general. The more, perhaps, risk takers.
Okay. How does inflammation impact the liver, and in a negative way?
Inflammation in your liver is always a negative thing to have. It damages liver cells. The liver cells break down, secrete various substances that cause scar tissue to form within your liver. That scar tissue eventually multiplies, forms nodules in your liver, and those nodules prevent the flow of blood in a normal way. That causes resistance of blood flow. It can enlarge some of the veins flowing into your liver and cause problems that way. But in addition to the scar tissue that forms, your liver malfunctions, doesn't produce all the products that it needs to do, doesn't detoxify all the toxins that come through your gastrointestinal tract.
So certainly the liver less effective, the more scarring, the more inflammation.
That's right.
Okay. How common is liver disease in general? And then let's look in Louisiana in particular.
Liver disease in its wider sense, and by that I mean fatty liver disease, which is the common disease that we see these days, is very common. It occurs in some form or other in about probably 30% of the population. And I don't want to scare anybody, because 30% of the population will not get serious problems with their liver, but they have some form of mild liver disease that will probably never affect their life. Otherwise, the other causes of liver disease, such as alcohol and viral hepatitis, are also common, but much less so.
Okay. When did we identify hepatitis as a disease? How is it spread? And most importantly, is there a vaccine to prevent it?
Hepatitis C was first called non-A, non-B hepatitis because we did not identify the virus until 1992. It is spread mostly through blood, either through infected blood transfusions or through sharing needles with some residual blood in them. But unfortunately, to date, there is no vaccine to prevent this transmission.
Working on it, I'm assuming.
Mm-hmm, that's right. There's a lot of work being done in vaccine design.
So we know what causes it and how it's spread, but we also know how it's not spread, and you felt like that was very important to talk about tonight.
That's right. I think a lot of people feel that they have an infection, they have to be extra careful in their daily contacts, and that's not true. I think the disease is spread through blood cross-contamination. We need to avoid sharing razors and need to avoid sharing needles, of course. If somebody's using insulin needles, even I'm not even talking about intravenous drug use. That's the main thing. In terms of things where we cannot get it, you cannot get hepatitis C through sneezing, coughing, or sharing a glass of water or utensils. You cannot get it through handshakes or holding hands, unless, of course, they have blood on their hands or open wounds.
Kissing, can't spread it through kissing?
No.
Okay. How do you screen for hepatitis C, and who should be screened for it?
Well, thankfully, the screening test is just a simple blood test that initially tests for the hepatitis C antibody. That tells us that somebody has been exposed to the virus. Doesn't necessarily tell us that the patient has active hepatitis C infection. And we'll discuss that a little bit later on. But it tells us that somebody's been exposed to it. Unfortunately, the majority of patients who have been exposed to it will actually have the virus. To actually test for the infection, we can do a specific hepatitis C PCR test that is a very accurate way of measuring the amount of virus in your blood.
Now, is this the kind of test that would be done in your annual checkup, or would you have to be complaining about symptoms to be receiving this test?
Many patients do not have symptoms at all, and therefore this test never gets done. Now, most patients will probably do have some abnormality in the liver test, and that may get picked up that way. But it can be completely asymptomatic with normal liver tests. So I think it will have to be something that your doctor will have to look at specifically.
But is it the kind of thing he would normally be looking for anyway in an annual checkup? In most cases, when you go for your annual checkup, they're doing some blood work. Are they looking for hepatitis C, or is that something that has to be requested?
No, that is something that has to be requested specifically. The CDC recommends screening baby boomers, those born between 45 and 65, because there is an increased prevalence of hepatitis C in that group. But of course, anybody with high-risk behavior, intravenous drug use, previous transfusions in the 70s and 80s, or previous medical procedures around that time should also be screened. The test is actually such an easy test that if there's any suspicion at all whatsoever about hepatitis C, it should be carried out.
And what about, does it run in families? Is there any heredity linked there?
No, there's no heredity, but of course, if you have one infected family member, there is a chance that another family member may become infected through blood contact.
Okay. Something else you mentioned I want to follow up on. You meant that a lot of people, or some people have it, but it's there and it hasn't fully formed yet. So it's there dormant, and then all of a sudden becomes alive? What happens? And do we know what triggers that?
It's a chronic condition, so it usually manifests itself 20 to 30 years after you acquire the infection. Other factors can come into it. For example, if you're drinking alcohol, that can speed things up. If you had a transplant and you're on anti-rejection medication or any medications that can suppress your immune system, that can also accelerate the course of the disease. And of course, there are some people who actually never progress to full-blown cirrhosis and liver failure.
All right. Delve a little deeper into who has it. Who are the people most likely to have it and who have it? These are people born in a 2-decade area. Why is that the case? Do we know?
Well, we think obviously at that time there was no screening of blood, contaminated blood transfusion, also perhaps attention to cross-infection and sterilization of instruments wasn't as much, but also engaging in high-risk behavior such as IV drug use was particularly prevalent in that generation.
Okay. And then let's talk about symptoms. You said for most people, there really aren't any symptoms? Shouldn't I be feeling symptoms?
No, a lot of people don't have any symptoms. Now that we're actually engaged in screening large numbers of patients, we're seeing a lot of patients who are completely asymptomatic and feel very well. Other patients feel some fatigue. They may have some what they call brain fog. They don't feel quite right. But in general, unless they have symptoms of full-blown cirrhosis with what we call decompensated liver disease or liver failure, most people don't have significant symptoms. So it's not something that your doctor will pick up during a routine visit.
What are some of the problems that can arise from chronic HCV infection?
Chronic HCV infection can cause, it's usually a disease that causes problems in the long run, as I said to you earlier, in 20 to 30 years after you acquire the disease. So if you acquire the disease in the 70s and 80s, you probably start showing problems right now. So hepatitis C can cause fibrosis, which is the development of scar tissue in your liver. It can cause cirrhosis, which is the development of nodules in your liver with associated complications of liver failure. When you may become jaundice, you get yellow skin and yellow eyes. You may start becoming confused with what we call hepatic encephalopathy. And I understand I'm using somewhat technical terms right now, but it's when you have a lack of detoxification of your blood through your liver because of poor liver function. And eventually some of these patients will develop fluid retention with distension of their abdomen and their legs, as well as the end stages may also develop liver cancer, primary liver cancer.
We don't want to talk about treatment options yet, but we will in a moment. But how important is it that it be caught early? So are the chances of being able to cure it better the earlier you get it, while it's still in the dormancy stage?
There's no such thing as a dormancy stage as such, because it's just a slow progression. But the earlier you treat it, the less chance of development of these bad things there is. So if, for example, you treat it when somebody has early stage scar tissue formation in the liver, the chances of advanced scar tissue forming and cancer and liver failure decrease significantly.
Okay, good to know. Look a little closer at cirrhosis and what it means for a patient and the care of cirrhosis patients.
So this is a good question, because I think a lot of patients with hepatitis C will develop cirrhosis, but once again, they may not have any significant symptoms. We currently treat a lot of patients with hepatitis C cirrhosis with antiviral drugs, and we can cure them. What we do, though, is that we eradicate the virus. We don't cure their cirrhosis. Their liver remains damaged and scarred and has these nodular formations. And therefore, it is very important for those people, even if they are cured of their hepatitis C infection, in other words, they're no longer infectious, they don't have the virus in the blood, but they do remain with cirrhosis. It's very important for these people to follow with a doctor and have 6 monthly screenings with ultrasound and blood work. And that's how we will pick up the development of liver cancer.
And you wanted to emphasize that point because you said not everybody does that, right? They're supposed to do that, but they don't.
That's right.
They hear the word cure and they feel time to move on back with our lives, right?
Right. I think sometimes, in the past at least, when hepatitis C was so difficult to cure, and patients had really bad experience with hepatitis C treatment, they often did not want to come back to see doctors. They were so happy that we cured them. But nowadays, treatment is easier, and we can come back to that in a minute. But I think it's very important to reinforce that aspect of follow-up.
Okay. Talk about the link between cirrhosis and alcohol and the importance of staying away from alcohol, or certainly limiting it for patients with cirrhosis of the liver.
There is a correlation between the amount of alcohol you drink and the progression of hepatitis C, and we therefore do recommend that if you have hepatitis C, you abstain from alcohol as much as possible.
Okay. You see that there on the graph. In a moment, we're going to be taking your questions and talking about treatment options for those with hepatitis C. But we invite you to call us with your question and to share your stories with us right now. Our phone number is 504-866-3200. That's 504-866-3200. Or you can send us questions by email at hhquestions@wlae.com. So what are the realistic expectations of Hep C treatment today, and how has that evolved?
We'll show you a graph later that shows the development of hepatitis C treatment over the years. The realistic expectations are that we will clear all the virus from your blood. We will be able to cure you with the medications that are available right now. This will either slow down the damage to your liver, ongoing damage to your liver significantly, or will completely stop the damage to your liver. And hopefully, with many years of lack of hepatitis C in your blood, you will start recovering, your liver will start recovering. But in addition to these somewhat abstract improvements, I think people already report significant symptom relief. The patients who do have symptoms, they do report that the symptoms get significantly better with the current treatments.
And we really haven't talked a lot about symptoms because in many cases the patients are asymptomatic. What are some of the symptoms with hepatitis C in the most damaging stages?
Well, in the most damaging stages, people get jaundice. People can have what we call gastrointestinal bleeding from big veins in their esophagus, which is life-threatening. They can develop fluid retention in their stomach and legs, and that gets treated with fluid pills, diuretics, which themselves have side effects. And lastly, they can develop this brain fog and confusional episodes, which are reversible, but they can be very disabling and they can prevent people from working and people from driving.
All right. So what are some of the ways we're treating hepatitis C today?
Well, we're very fortunate to live in 2016 because we have a lot of medications which are now available to cure hepatitis C. A lot of our patients are somewhat reluctant to come to see us because they still remember the old days of interferon injection therapy. That was a drug that was initially given 3 times a week and subsequently once weekly in association with some other drugs. It had terrible side effects.
Such as?
Such as extreme fatigue, upper respiratory tract, flu-like symptoms. Sometimes it had, it would cause a drop in your blood counts, anemia, low white count, and it was pretty disabling. People always, if they've ever had interferon, they remember it.
So we're not using interferon anymore to cure hepatitis C or to treat hepatitis C.
That's right. We no longer use interferon. We don't need to use any injection therapy. That is old news. We now have fully oral therapies that usually last between 12 and 24 weeks. Most people will probably need 12 weeks of treatment. The new medication is oral, as I already said. The few side effects that are associated with the treatments are very well tolerated. Some people get some headache and some fatigue. These are the main things. But they're very well tolerated. People can continue to work and continue doing their daily functions. Not only that, but we nowadays have so many options available that some patients that we were unable to treat in the past, some people on dialysis, for example, we're now able to treat and cure.
Mm. So to conclude, and you brought a graph that shows the progress we've made, you really have, the medical community has made great progress in treating hepatitis C, right?
That's absolutely correct. I think when I started hepatology, our treatment cure rates were probably in the low 20% to 30% range. Then we progressed to the interferon once weekly treatments with cure rates around 50%. But nowadays, we can really reliably see cure rates in the 90 to 95% range, sometimes even higher.
Mm-hmm. Very encouraging. We're ready to take your calls now and emails. Our phone number is 504-866-3200. That's 504-866-3200. And again, our email address is hhquestions@wlae.com. We're going to take a break and be back with your questions in just a moment. This is Hello Health on WLAE.
Did you know kids who play outdoors have healthier lungs?
Totally.
Did you know that boys that play with dolls make better husbands?
My son has lots of dolls.
But did you know terry cloth diapers breathe better?
I did.
It's totally true.
Oh, yeah.
Did you guys know statistically friendly kids have more friends?
Yeah.
That's obvious.
Did you know most people think they're using the right car seat for their kid, but they're not?
Parents who really know it all know for sure that their child is in the right seat. Visit safercar.gov/the-right-seat to make sure your child is protected.
So who's going to do what?
I'll pack the dead batteries.
Great.
I'll only put what I don't need into a duffel bag.
Perfect. That's totally unhelpful.
No problem.
Meanwhile, I will try to comfort everyone by speaking in a calm voice. And who is going to handle supplies?
I can forget to do a list for us.
Thanks, pal.
We couldn't be any less prepared. I'm proud of you guys.
Talk to your kids about who to call, where to meet, what to pack. Visit ready.gov/kids for tips and information.
And welcome back to Hello Health on WLAE. Tonight we're talking about hepatitis C. Our guest is gastroenterologist and hepatologist George Therapondos. And now we go to your questions. Again, our phone number is 504-866-3200. That's 866-3200. Let's go to line 1. Al is calling us from Covington on the North Shore. Al, welcome. You're on Hello Health.
Well, thank you very much for having me on. I have two questions, real quick. Is today's treatments for Hep C, chelation, would that be an effective way of going to cleanse the liver and help cure Hep C? And secondly, could you consider Hep C a cancer as opposed to just being a disease?
Let's see.
The chelation therapy, I think that Al referred to, was a therapy that was used in the past. Is Al still on the line?
Al, are you still with us?
No.
Nope. Okay, go ahead.
I'm not quite sure whether he was referring to chelation or whether he's referring to a phlebotomy where you take some blood out, because there was some thinking that overabsorption of iron was responsible for some of the hepatitis C features. The answer to that is no. Treatment for hepatitis C, which is a virus, is antiviral treatment. It's basically medication to cure the infection. So chelation therapy doesn't come into it.
Okay, and he asked about the clarification of it perhaps being a cancer.
Hepatitis C is an infection that can lead to cancer, but it's, having most people, the vast majority of people with hepatitis C will never get cancer in their lives. Probably 2% of those with hepatitis C chronic infection will develop cancer.
And that's liver cancer?
Liver
right?
cancer, primary liver cancer, yeah.
Okay, very good.
Now, hepatitis C can be associated with certain types of lymphoma, but that is even more rare.
Okay. Al, thank you for your question tonight and your call. Our phone number is 504-866-3200. That's 504-866-3200, and we do have lines open. Let's go to some emails now. Here's one. Doctor, why are the Hep C meds so expensive? Do you see all insurance companies covering the meds in the future? So I guess you put things into perspective. I guess they're not covering them all now, right?
Well, I mean, just to try and answer the first question, I don't work for the pharmaceutical companies. They determine the price. So I can't answer why they're so expensive, other than to say that development of these drugs has taken many years, and it is an expensive process. But I can't really address that issue at all. In terms of what insurance companies cover these medications, I think at Oxnard we have a great team of people that work exclusively on hepatitis C. We have a team of physician assistants, a team of 3 who work full-time on hepatitis C, and we have a clinical pharmacist placed in our clinic specifically. And they work with the patients and their insurance companies to get coverage for these expensive drugs. And I have to say that we're very successful at getting most patients treated. Okay. I think the answer, obviously I can't address any specific insurance questions, but I think all insurance companies do provide some cover, and I would say that the majority of insurance companies are moving rapidly towards providing cover for all types of hepatitis C infection at all stages. There was a move to, initially there was an attempt to approve these drugs, these expensive drugs, for the treatment of the most severely affected patients. But there is currently an ongoing move to approve even the mildly affected patients.
Okay. Our phone number is 504-866-3200, 504-866-3200. If you're a Hep C patient and wouldn't mind sharing your story, we'd love to hear from you tonight. Here's another email question, Doctor. I did 2 months of Harvoni last year and am still undetectable for the virus. And this is not something we talked about, so maybe you could talk about that. However, the treatment did have many side effects, and I am just starting to feel well again. This is from Chris. Chris, thank you for your question.
That's a good question. I think we consider cure if you remain virus negative 12 weeks after the end of treatment. I mean, now we're in 2016, I presume Chris finished treatment in 2015, so he's 6 months after the end of his treatment, so he's considered cured. You know, some people do experience side effects. As I said, the majority of side effects include headache and fatigue, but there are some other minor, less common side effects, I should say, and certain people are more seriously affected than others. I'm glad to hear that Chris is already beginning to feel well. You know, one has to consider how advanced his disease was, because if he did have advanced cirrhosis, that may be one of the reasons he had a lot of side effects, and it may be one of the reasons why he's still not feeling 100%. And I would recommend checking with his doctor about the stage of his disease.
Can hepatitis C return once it's been eliminated from the blood?
Well, it can return because of 2 reasons. You can either become reinfected, because you expose yourself to risks again. It can flare up, but that's a very, very rare occurrence.
Okay. Phone number again is 504-866-3200. We do have phone lines open. There's the number at the bottom of your screen, 866-3200. Or we're also taking email questions tonight, and you've been sending us some, including this one. Doctor, when would a liver transplant be an option for liver disease and/or cirrhosis? And that's something we didn't talk about as a treatment option. You hope you never get there.
That's right. Liver transplantation is not necessarily necessary for cirrhosis. There's a lot of people with cirrhosis who actually feel well, and as long as they're screened for the development of hepatocellular cancer and liver failure, they don't need a liver transplant, but they do need ongoing medical care. But liver transplantation would be a great option for somebody who has a small liver cancer due to their hepatitis C, and it would be a great treatment for somebody who has liver failure. You know, there are certain criteria that somebody has to meet before they can qualify for a liver transplant.
That's a whole nother team at Oxford.
That's right. Well, it's still our team, but you know, it's. I don't think we should get into the details of what qualifies you for a liver transplant, but liver failure and liver cancer can qualify you for that.
Okay. Go back to our email questions, and again, our phone lines are open at 866-320, 504-866-3200 is our phone number for tonight. Doctor, when skin turns yellow, does that mean Hep C is too advanced for treatment? So an extreme case of jaundice.
That's a great question. That's somewhat controversial right now, actually, but and without knowing all the details of this this person's condition, I can't really answer that. It may not be too late for hepatitis C treatment. We may be able to cure this person, and the jaundice may disappear. But I would say that if somebody's jaundice, they definitely need to come and see us, because they may need liver transplantation.
What is it that causes, in the failure of the liver, what is it that causes the discoloring of the skin?
It's bilirubin. It's a simple blood test that we can measure. It's a breakdown product of red cells.
Okay, but what is it that causes, what's going on in the liver that makes someone's skin turn yellow?
It's the abnormal processing of waste products in your liver that doesn't happen as efficiently.
Okay. Here's another email question, Doctor, as we wait for your phone calls at 504-866-3200. What does it mean if your blood test shows a trace of Hep C? This is a question from Bill. Bill, thank you.
Well, that's terminology that we don't use. There's no such thing.
Is there a scale?
Well, we measure hepatitis C viral load. We call it viral load, and it's the amount of virus in your blood. So when you say that your blood shows a trace of hepatitis C, it may mean two things. It could indicate that you have a low viral load, in which case you do have the infection and I think you need treatment. Or it could mean that you have been exposed to it, you have the hepatitis C antibody, but you have cleared the virus from your blood. So it's a very non-specific term, and I think I would urge Bill to seek clarification about that from his doctor, whoever told him that.
Okay. Our phone numbers are 504-866-3200. That's 504-866-3200. We have a special number set up just for viewers of this program to reach doctors like Dr. Therapondos or any other guests on this program, and we'll be sharing that at the end of tonight's program. So there are people who have hepatitis C in their blood but never develop symptoms and never have damage?
That's right. There's two types of patients. There's the patients who get an acute infection and clear the virus completely. So
happens naturally?
It happens naturally. Probably 15 to 20% of patients will acquire hepatitis C through one way or other, but they would just get rid of it on their own. And those people will not have any long-term damage and no ill effect from it. Now, out of the other 80 people who remain with chronic hepatitis C, again, the vast majority of them will not really develop serious problems. They may develop mild scar tissue formation over the years, but only a minority will develop cirrhosis and liver disease and liver cancer. So a lot of people may have chronic infection, may have some minor symptoms, but they may not develop deathly complications.
We know that many of the cases you have already pointed out were the baby boomer years when we didn't know a lot of the things we know about now. So are we seeing it on the decline, and do you think there will be a day, now that we know what we know, that you'll be out of the you'll be treating other liver diseases but not hepatitis C?
I think that's hopefully going to be someday in the not too distant future. I can't estimate when that will be. Certainly we're all moving in that direction. Treatments, as I said, are very successful and we're very hopeful. I think the problem is lying with identification of infected patients, which is not that easy because people are not coming forward for screening.
So this is, again, just to reiterate, earlier in the program we talked about this is not a blood test. So if you go in for regular blood work, your annual health checkup, they're not screening for hepatitis C. Do you recommend, especially for those in those decades, with 40s to 60s, is that right?
That's right.
40s to 60s, born 40s to 60s. Do you recommend that they ask for this blood test, and would they ask their general practitioner?
Yes.
Okay.
I think this is a test that the general practitioner can easily do and order, and already a lot of general practitioners in the city are doing that, but it's worth reminding them because they may have done it in the past, and if it's negative, they don't need to have a recheck.
Okay. Let's go to, so if I don't have it and I haven't been exposed, none of those other, it's not like it can show up negatives. There's no double negatives with you. Either have Hep C or you don't.
Yeah, exactly. You don't need to, you need a one-time test unless you've been exposed to risk factors again.
Again, right, okay. Let's go to our phones. Bill is calling us from Metairie this evening. Bill, welcome. You're on Hello Health. Good to have you with us.
Yes, doctor, my question is this. I used to donate blood at least twice a year, and I did it for many, many years. And the last time I went to donate blood, the blood bank, I won't mention which name, the blood bank told me that I could not donate blood anymore because I had a trace of hepatitis and I should go see my primary care physician. So they gave me a letter and I went to my primary care physician and he ran the blood tests and he got the results and said, you have no trace, as far as he could see, I have no trace of hepatitis C. So my question is, who should I believe?
Well, that is a good question. I think if the test that was run by your GP was clear, I would. certainly believe them. I would maybe get him to recheck your hepatitis and also to recheck your hepatitis B. Are you sure that they talked about hepatitis C?
Well, no, I'm not sure of that. They just told me I couldn't donate blood because they found a trace of hepatitis. I don't think they said C. I don't remember exactly.
Yeah, I would perhaps go back to your doctor and get the hepatitis B check as well. Although it's unlikely if you've donated in the past. When was the last time you donated before this last visit?
Oh, it's been a while. It's I would say 10 years.
Oh, okay. I think it's worthwhile getting a repeat test from your doctor for both hepatitis B and C.
Right. Okay, thank you very much.
Bill, thank you for your call and for your offer to donate blood. Very generous of you and obviously needed always. Let's go to line 2. Mary is calling us from Metairie this evening. Mary, you're on Hello Health with Dr. Therapondos. Go right ahead.
Hi, I just wanted to ask, is all hepatitis C contagious?
Yes. It's contagious in terms of being transmitted through blood, yes.
So blood-to-blood contact, Mary, but nothing beyond that that we're sure of, right?
That's right.
Okay.
I mean, there is also, I think we recommend avoidance of unprotected sexual contact, but the chances of transmission through sexual intercourse are somewhat remote.
Okay. Mary, thank you so much for your call tonight. Our phone number, 504-866-3200. That's 866-3200. Let's go to Dorothy calling us on line 3 this evening. Dorothy, welcome. You're on Hello Health.
Hi. Thank you for taking my call.
You're welcome.
If I'm not showing any symptoms, but I did test positive, why would I have to take the medication?
That's a great question. For 2 reasons. You may not need to take the medication if you have very early disease that has not particularly affected your liver. And we know that some cases, even of long-term infection, actually do not result in a lot of liver damage. However, it is possible that you do not have symptoms but have very aggressive and progressive disease. So in other words, you may have cirrhosis, but you don't even know it. You may feel very well, and we do find these patients in clinic from time to time, in fact not infrequently, who have cirrhosis because of hepatitis C. They feel perfectly well and they go about doing their normal stuff. I think you need to be screened for advanced liver disease, and then we'll have a question with you as to whether we need to start treatment or not. Does that answer your question?
Yes, thank you so much.
Thank you, Dorothy, for your call. So sometimes your answer might be let's watch and wait and continue to test if you feel fine and everything else.
Mm-hmm. That's absolutely true. I think it's a somewhat controversial issue in that some people with infection feel that they just want to get rid of it, but we don't know whether somebody who's had the infection for perhaps 20, 30 years hasn't ever shown any signs of it, would do investigation, it doesn't show any damage to the liver, it's likely that infection will not progress to anything more serious. So, the caller's question was very justified. But the danger is that, despite feeling well, you still have serious liver disease.
So how often are you going to test for that liver disease?
If we test, probably not more often than once every year or even every 2 years.
Okay, good. All right, let's go to line 4. Diane is calling us this evening. Diane, welcome. You're on Hello Health.
Hi, my name is Diane, and I wanted to let you know I contacted FC when I had a blood transfusion when I had my son in 1970. And my doctor is getting ready to put me on Sovaldi and Ribavirin. And I was wondering, does it help to get rid of the Hep C?
Yes, I think it does help to get rid of the Hep C. Obviously, I don't know the details of your liver disease, but I presume that your doctor has detected some signs of chronic liver damage, and he or she are estimating that getting rid of the Hep C will get rid of or at least stop any progression of the damage that you already may have.
Diane, are there any symptoms now?
Good. So that's why he's put me on the medicine.
I'm sorry, we missed a part of it. What did you say? Any symptoms now?
Hello?
Yeah, any symptoms now, Diane? Oh, we may have lost Diane. Diane, thank you so much for calling. Let's go back to our phone lines, and we do have phone lines open, by the way, at 866-3200. Michelle is calling us on line 1 this evening. Michelle, welcome. You're on Hello Health.
Yes, thank you for taking my call. I was wondering about the relationship between alcohol and hepatitis C with or without treatment.
Well, hepatitis C is made worse by drinking excessively. In terms of the treatment, we prefer to remove all other causes of liver damage while we are administering the treatment. It just, it complicates the side effect profile of the drugs, and it makes, sometimes the alcohol can raise liver enzymes, and we would like to see them getting to normal once we administer the treatment.
Okay. And so if someone is cured, does that mean they can go back to drinking or no?
Well, not necessarily. It depends how advanced the liver disease is. If they have cirrhosis, we would definitely recommend no drinking. If they have virtually no scar tissue formation and they want to have the occasional drink, that wouldn't stop them on that occasion.
Okay. Let's go back to our phone lines. Line 2, Monica calling us from New Orleans this evening. Monica, you're on Hello Health with Dr. George Therapondos. Good to have you with us.
Hi, thank you. If I was tested and the doctor said I had Hep C antibody positive, does that mean I have active virus, or do I need more testing?
Yes, Monica, you need more testing. That means you've been exposed to the virus. Your chances of having the virus in your blood is about 80%, but you need to get an RNA test to see if you're carrying the virus. And if you're not carrying the virus, if the RNA test is negative, you don't need any treatment.
Good enough, Monica?
Yes, thank you.
Okay, thank you for your call. Again, our phone number, 504-866-3200. That's 866-3200. Sheila is next, calling us on line 3. Sheila, you're on Hello Health.
Yes, they told me I had hepatitis C, but I also have psoriasis. And they told me that they could not treat the hepatitis because of my immune system with the psoriasis. So I just felt doomed. Is there any help for me?
Can I just clarify, you have psoriasis or cirrhosis?
I have psoriasis, psoriatic arthritis, which is psoriasis of the skin.
Okay.
Okay.
Not cirrhosis, at least
no.
the way she's describing it, right?
I think, and why were you told that you cannot get hepatitis C treatment?
I was going to LSU clinic and they diagnosed my condition that I had psoriasis. That was after Katrina. And they told me due to my immune system being low, the medication from the that they give you for hepatitis would just make me even lower. So they did not advise me being treated for the hepatitis.
A weakened immune system.
Was this information given to you a long time ago?
That was given to me right after Katrina.
Yeah, I think things have changed. The medication we use right now is a lot easier to take, and it doesn't weaken your immune system. So it doesn't affect your immune system. So obviously we'll have to check to see what other medications you're taking right now to see if there are any interactions between the medications we're using. But my guess is that there shouldn't be any reason why we could not treat you. So I think you should be treated right now.
Okay, good. That's encouraging news, Sheila. We hope you'll check back with your doctor and take another look. New medications out there that could be helpful to you, even in a weakened immune system case. Our phone number is 504-866-3200. Just a couple of minutes left if you have any final questions for Dr. Therapondos. So we started the program by sharing news from the CDC. Did any of that surprise you? Because it seems like the theme has been we're heading in the right direction, but now we're hearing about more cases and more people actually dying from the disease, right?
Well, I think it doesn't surprise me, actually, for a number of reasons. I think the study that we just quoted talks about treatments between 2010 and 2014.
Yeah, because these statistics lag.
That's right.
Right. So we're not talking about yesterday or today.
Right. And you know, widespread treatment with the new successful medications really probably started coming into effect in around 2014, and much more so in the last 2 years. So I think we are going to see a very beneficial effect in the coming 5 to 10 years. It does take a while to see the effect in the population. The other concerning thing we do see, however, is the fact that despite our efforts at screening, there are a lot of people who present very late. And at that point, it's very difficult to treat, and the treatment options are very few in terms of, you know, they have liver cancer. It's very difficult to transplant those people and cure them.
Okay. Again, I just want to follow up on that question we asked earlier, because people may be asking themselves, especially with this latest information. Should people and who should be requesting a Hep C test from their primary care physician?
Well, the short answer to that is that if you feel that you have risk factors that may have exposed you to hepatitis C, you should get screened with a simple blood test. If you were born between 1945 and 1965, we recommend screening as well.
Okay, very good. And what was the point you were hoping? You know, most doctors come here, they're hoping to send at least one message that people will take away from tonight.
Well, my message would be a positive one in that, you know, we have great medications that are very easy to take, relatively few side effects and high cure rates. And I think we can make a big difference in the death rate for this disease with the current treatments we have available, as long as we continue to screen and detect this disease early in its asymptomatic stage.
Okay. And how often should people with a history of drug use be tested?
Well, as long as they're using, I mean, if they're no longer using, one test is enough. If they're ongoing drug users, you know, they should be tested more frequently.
And it's not the drugs themselves, it's the needles. So
it's the sharing of needles.
Sharing of needles, right, with drug use. Okay. Well, I want to thank Dr. Therapondos for his being with us tonight, for the information, education he's provided, and for his work in the Ochsner Health System. Thanks so much, Doctor.
You're welcome.
All right. Well, to make an appointment with any Ochsner physician, including tonight's guest, or to register for any of Ochsner's Hello Health seminars, you know, they take place almost every week across the greater New Orleans area, you can call Ochsner at this special number, 504-842-5669. That's 842-5669. To rewatch tonight's presentation or any of our Hello Health programs, they're on our website, many of them at WLAE.com, or on Ochsner's website, most of them are there too, at ochsner.org. Well, you know, if you've ever moved out of a home to another one, when you're leaving, there's always those mixed feelings about the excitement of moving to a new place, but all the memories you'll be leaving behind. I want to show you the WLAE studio, at least the way that I remember it, for about the last 10 to 11 years. Absolutely beautiful. It was created shortly after the storm and really took WLAE, I think, television to a whole new level. I want to thank, of course, Steve Schneckner and Wendell Basinger, designing, lighting, Ron Yeager, Jim Dotson, Mark Kudrain, for approving this project. Of course, Father Tom Chambers praying for the success of it and ultimately approving what happened here at WLAE, the investment we made, ultimately in new equipment, Tommy and Dave and the whole team that put that together and making it happen. We're leaving our studios here at WLAE in what was the UNO Jefferson campus building, now a new owner. WLAE, at least temporarily, will be moving to a facility in Elmwood. But lots of great memories here. And this program and the Greater New Orleans program and lots of the quality shows you see here on WLAE. So I thank those who approved us being here in this wonderful studio, and those, obviously even more important, the people who brought it to life, at least for us, on a weekly basis here on Hello Health, starting with our director, Anna, Richard, Naila, all those behind the scenes, the newest members of our crew too, making it happen, and Susan and Diana, who work so wonderfully on this program from the Oxner side to bring it to you on a weekly basis. And of course, our guests, who do such a wonderful job passing along wonderful information to you. So I thank the team, and we'll see you back here in August live again. So we'll be going away for about a month. Our programs will be here, encore presentations every Monday night at 7 o'clock, and we look forward to seeing you at our new home starting in August. Our thanks again to tonight's guests. Thanks to Humana and Oxner for making our program possible. And our final thanks, as always, is to you for your support of this program, Hello Health, and our station, WLAE.
Hello Health on LAE is presented by the Oxner Health System, a nonprofit academic multi-specialty healthcare delivery system dedicated to patient care, research, and education. The Oxner Health System includes 8 hospitals and 38 health centers located throughout southeast Louisiana. Oxner, healthcare with peace of mind.
When Rose first started with us, she was just coming out of the hospital.
It's been a better situation. I can always depend upon her to help me. I'm home, and that makes me happy.
We're here to get her back into her routine and be able to live the life she wants to live. It's an honor to be trusted with that responsibility.
Hi, I'm Tom Bagwell, the host of Hello Health here on WLAE. You know, we've been doing our program from this studio for more than 5 years. In August, we're moving to a new home. Same channel, just a different studio. It's going to take us about a month to make the move, so in the meantime, we hope you enjoy this encore presentation of an earlier Hello Health program. And we look forward to seeing you back here live in August on WLAE. Hi, I'm Tom Bagwell, inviting you to join us on Monday, June 27th for the next edition of Hello Health. We'll be talking about hepatitis with Dr. George Therapondos. We'll be discussing recent developments in screening evaluation for hepatitis C and treatment options. Our next Hello Health is presented by Oxner and Humana, and it's Monday night, June 27th at 7 o'clock, only here on WLAE.